it's a very tough start. It's looking at the speakers and the talks and set the AI for a session like this, and a lot of us are used to giving talks of the work that we do, which is much easier than giving a generic talk, especially setting up a context in a very, very broad way, which is very, very hard. So I'll take a very modest attempt at this, but I leave a lot of details for the other talks to come in. On one thing that earlier this month, in April, I had a very similar experience. I gave a talk to with one of my co-speaker is actually from Bay Area. So she was talking about digital pathology and other things, and I'm talking about AI. And it, from my side, I realized after the talk, it was a very, I wasn't happy. Because I was talking about graph CNNs, I was talking other things and all that stuff, right? But I couldn't filter it down. So I tried the other approach here, which is let me see very broad, and then hopefully that'll set the context for the day and see. So what we are hearing, I mean, this is what we are all hearing. There's nothing magic. On the right-hand side is all the big tech saying things like how it's going to be transformative, what can we do. Both from a business perspective and both from a helping humanity, how we bring the healthcare. On the right-hand side, all the the big the pioneers or even the deans of big schools and other things saying that where the care should head, whether it's being very personalized medicine, or looking at the perfect drug or completely change the diagnostic path flows. So the goal is essentially AI. I mean, end of the day, if you filter everything down, I think there is a common consensus that says the AI should handle specific tasks, freeing the clinicians to focus more on human aspects of care. That essentially is a very, very broad common goal. Okay, so from there, if you look at the objective, the quad objective of the healthcare by a lot of national mandates, right? So the quad objectives are pretty much improving, there's nothing I'm preaching to the choir here, right? So you all know this. I'm just setting up the context for this. On the AI side, there's a whole bunch of, you see a whole bunch of activities from either it's from drug discovery, omics research, medical imaging, or predicting or modeling of diseases, right? So, and where do these two things come in, and what should we do as a clinician, or what should we be asking? I'm not going to talk about applications because there's a lot of speakers talking the rest of the day. I'm going to set the context on what should be looked at, okay, at a very broad level. Okay, so in my view, there are three dimensions to this. One dimension is all these healthcare applications. Some are coming in the short term, some are coming in the medium term, some are coming in the long term, that could fundamentally change the practice. Okay, but those are the rest of the day. The talks are, talk about it the rest of the day, because a lot of people that are pioneers in this, that are making this change is happening. But there are two other aspects that we all should combine and understand, which is that what are the AI models behind them, and what kind of things that happen in what should I look at models? Not that a large some of us are building these models, but if I'm using those, what should I look at, and what are the data sets? Because those are the new diagnostics. I'll give an example. This doesn't mean it's about AI. It's any model. So, for example, like 3-4 weeks back, I did a complete thorough checkup, and my things are fine. My ApoA is fine. My ApoB is fine. My ratio is fine. My lipoprotein A, LPA, was higher. I was a little miffed. I said, why? So I looked at what is a model here. What is a model and how it's just, and then I realized, you just do the antibodies, you get this thing, and you measure the cloudiness of the final thing, right? So to measure the cloudiness, what do? You do a scattering of the light. Okay. Once you do scattering of the light, then they're measuring it, but then they already know the theory that the scattering of the light also depends on the size of the ApoA, which is genetic. Okay? So the model is taking off one assumption off and giving a number. Second thing is, and they're comparing the distribution. And I looked at the distribution, and then they said, on the data side, right? So what is the distribution they're comparing my score to? The distribution is, it's a non-Gaussian distribution. So they're taking some assumptions. So it is a good measure, not because it's not, but now I can know how to relate that measure. It's not elevated or anything, but it's just above the normal, which is moderate. They didn't say anything, but and the focus of my talk is those two things, the healthcare applications. So I'm going to give a brief this thing on why we need to look at models, why we need to understand a whole bunch of things about models when we are doing some of these diagnostics, and what data sets, what do we need to look at the data sets.